A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. I am Dr. Professor Khan Shakil Ahmed, Head of the Department of Forensic Medicine at the Akij Medical College, Khulna. Dear students, there are some duties of a doctor according to medical ethics. We divided that duties into three groups. Duties of a doctor towards sick, thereafter duties of a doctor towards his colleagues, and duties of a doctor people in general. So here we should discuss about the doctor's duties in general. A doctor should always maintain highest standard of professional conduct. A doctor should not do any unethical medical practice. Then a doctor should not do anything which can weaken the physical and mental resistance of a patient. Thereafter, a doctor should not neglect a patient. Never, you should not neglect a patient. You should not neglect a patient. A doctor should not be influenced by any motives of benefit. In case of issuing medical certificates, medical legal reports, and to give expert opinion in the court, a doctor should only mention what he can verify or prove. No other things should be said. A doctor should very much careful in case of publishing his opinion, observation and discoveries. That is all about the duties of a doctor in general. So we divided the duties of a doctor in three groups: one in towards sick, one towards the colleagues, that is medical etiquette, and one is duties of a doctor in general. Now, it is very important thing is, what are the characteristics of an ideal doctor? That is the pen picture. That is the pen picture of an ideal doctor. It is very important for written and oral examination and our daily life. A doctor must be modest, sober and prompt in his duty. That is, a doctor must be modest. He should be modest, sober and prompt in his duty. That is, he should not show the delay characteristics. That is, a patient came to you are reluctant, you are very reluctant. No, you should prompt in your duty. A doctor must be pure and upright in his character. That is, you should not do any adultery with your patient attendance. A doctor should uphold the honor and noble tradition of medical profession. You are the responsible person. Whenever you become a doctor, you are the responsible person to uphold the honor and noble tradition of medical profession. A doctor should prescribe proper and suitable medicine. What is proper and what is suitable medicine? Proper means the medicine which are indicated for the disease, and suitable medicine. In case of suitable, you have to consider the ability of the patient. You wrote a medicine which is costly, but the patient cannot afford the medicine. He can't buy the medicine. So ultimately, he or she can't receive the treatment. Okay. So you have to cautious about that regarding prescribed medicine. A doctor should use clean and proper instruments and appliances. Until otherwise, a patient may be suffered from tetanus. Thereafter, a doctor should obey strictly the courts of Geneva Declaration. I previously told about that. A doctor should not neglect a patient. Yes, obviously, you should not neglect your patient. A doctor should not do any unethical medical practice. I told previously. A doctor should be responsible for community health. Yes, you are the responsible person in your community. Whenever you see some communicable disease, you have to inform the appropriate authority about that communicable disease. A doctor should use average degree of skill, care, judgment, attention during treatment of a patient. A doctor should show dedication dealings with patient. That is the pen picture of an ideal doctor. And now, what is the rights and privileges of a doctor? What are the rights and privileges of a doctor? You are a doctor, you have some rights and privileges. You are a doctor, you have some rights and privileges. Right to practice medicine. You can practice any type of medicine. Right to choose your patient. Right to dispense medicine. You can sell the medicine. Right to add title, descriptions, etc. to your name. Right to recovery fees. Okay, it is the main thing. Right to recovery fees, and then right to hold official appointment. You have every right to hold any type of official appointment from where you obtained your graduate degree. You have every right to hold your official appointment in public, in private, any type of organization. right to issue medical certificates and medical legal reports. But you have to be careful that you should not any right to any unethical practice. You have to write the original one. Right to give evidence as an expert whenever asked by the court to give expert opinion such as for postmortem, for injury report, like that. Right to supply dangerous drugs to your patients whenever required. These are the rights and privileges of a doctor. So, right to practice medicine, right to dispense medicine, right to choose a patient, right to recovery fees, right to supply the dangerous drugs to the patient whenever needed, right to hold an official appointment, right to issue medical certificates and medical legal reports, and right to give valuable opinion whenever asked by the court. So, this is all about the rights and privileges of a doctor. Like a doctor, a patient has also rights and privileges. What are those? He can choose a doctor. He can choose his own doctor. He may refuse you. So access. He has every access to enter any kind of healthcare facilities. Right to receive the treatment with dignity. You have to show some dignity whenever you treat the patient. So that is the right of your patient. Privacy. Right to receive treatment with maintaining full privacy. I just want to say you one thing, that whenever a patient came to your chamber, you have to maintain privacy. But nowadays we see that in some private chamber, we see that 3 or 4 patients came to his chamber and the doctor is used to see one of them serially. But it should not be practiced. You should maintain the privacy. It is the full right of the patient. Confidentiality, yes, a privacy and confidentiality, it is in close relation. Right to receive treatment with confidentiality. You should not disclose to anyone. That is safety. He has every right to treatment with maintaining proper safety. That is, whenever you do your operation, whenever give you some investigation like angiogram, angiography, invasive investigation, so you should maintain the safety. A right to know. Your patient has every right to know about diagnosis, about treatment, about the procedure, about the investigation, about the prognosis and alternative treatment. What is that? Right to know about the diagnosis. Mr. Doctor, the disease which I am suffering from, he has every right to know. You should tell him that you are suffering from this and that. What is about my treatment? You give such medicine. What about the medicine? You have to describe the medicine to your patients. Procedure, like operation, that is a patient is suffering from gallstone. You should tell him that you are suffering from gallstone, that is known as cholelithiasis. So I have a plan that you have to go under operation and the procedure is like that. Investigation, you have to do some investigation as because you have to general anesthesia for the operation, so you have to do these investigations. What about the prognosis? Okay, after operation we will be good. If there are any alternative treatment, yes, we have alternative treatment. You suggested laparoscopic cholecystectomy, but when you have to inform him that there is another alternative treatment, that is you can operate him by opening the abdomen. So it is every right to know about his disease, about his procedures, about his information. It is every right of the patient. And he can refuse you. It is also his right. Yes, right to refuse any treatment and investigations. Comfort. Right to receive the treatment with full comfort, as because he or she is paying you. Complaints. He can complaints against you in the higher authority if he thought that you are not maintaining the proper dignity or proper treatment. And whenever for your lackings, he can complain for compensation. So these are the right and privileges of a patient. He can choose. He has access, dignity, privacy, confidentiality, safety, right to know, refusal, comfort, complaints, and compensation. That is all about the medical ethics. So, in a nutshell, at first we tell about the dictionary meaning of ethics. Then we told that is the ethics means voluntarily self-imposed code of conduct. Thereafter we told about the definition of medical ethics, what is medical ethics, the moral principles which should guide the members of medical profession in course of practice their medicine, dealings with their patient, dealings with their other members of the medical profession and even the state. Thereafter, we told about Geneva Declaration. And what is Geneva Declaration? The Geneva Declaration, World Medical Association, in their third General Assembly in Geneva, Switzerland, they adopted the Code of Geneva Declaration September 1948. Thereafter, it is accepted as an international code of medical ethics after 1 month in London, that is October 1948. And from then, it is known as Geneva Declaration. And there is no difference between the International Code of Medical Ethics and Geneva Declaration, as because at that Third World Medical Assembly, the Geneva Declaration is adopted and accepted as an International Code of Medical Ethics after 1 month. So we told about the Code of Geneva Declaration. I solemnly pledge myself to consecrate my life to the service of humanity. And these 10 points we are making voluntarily. And thereafter, we told about the medical etiquette, the specific behavior we have to show towards our colleagues. That is one. And thereafter, we told about the rights and privileges of a doctor and the rights and privileges of the patient. So that is all about from the medical ethics, and it is very, very important for our daily life, our practicing life, and as well as for our examination, both for MCQ, SAQ, and the oral and practical examination. Thank you. Assalamu alaikum wa rahmatullah.